Acquired brain injuries. Information, planning and tools to help you navigate. What is an ABI? Any type of brain injury that occurs after birth is referred to as acquired brain injury, ABI. In general, ABI does not result from congenital disorders or degenerative diseases such as Parkinson's, MS, and Alzheimer's. Traumatic ABIs, also known as TBIs, are the result of blows to the head or shaking of the head. Examples are falls, motor vehicle accidents, sports-related injuries, work accidents, and intimate partner violence. Non-traumatic ABIs are the result of illness, such as meningitis or brain aneurysm, stroke or oxygen deprivation, anoxia. Overdose and strangulation are common causes of anoxia.
According to statistics collected for Injury in Review, 2020 edition, Spotlight on Traumatic Brain Injuries Across the Life Course, over 20,000 people are hospitalized for TBI in Canada every year. Between 2002 and 2016, there were approximately 235,471 injury deaths, and of those 53,200, 22.6%, were associated with a TBI diagnosis.
Less than age 5. Falls are the most frequent reason for TBI hospitalizations and ED visits among children under 5 years of age. TBI deaths of children under 5 years of age are most often the result of transport incidents or abusive head trauma. Age 5 to 19. Sports and recreational activities emerge as a leading cause of TBI-related hospitalizations and ED visits. Age 20-39. Assaults are a leading cause of TBI hospitalizations and ED visits among males 20 to 39 years of age. Age 40 to 85. Non-sports and recreation-related falls take over as the predominant mechanism of TBI-related deaths, hospitalizations and ED visits, with especially high rates among those 85 years and older.
An ABI can adversely affect a person's quality of life in numerous ways, including cognitive, behavioral, emotional, and physical effects that affect interpersonal, social, and occupational functioning. In addition to the impact of ABI on the individual, ABI can negatively impact families, communities, and the economy.
Other signs and symptoms include headaches, fatigue, and sleep disturbances. In addition, secondary neurologic disorders such as mood disorders and post-traumatic epilepsy can occur following TBI and disrupt health-related quality of life.
Possible cognitive, physical, and behavioral emotional changes.
Directing attention. The person may have difficulty focusing on a specific task or the important parts of the task. He or she may appear uninterested in or unaware of what they are being asked to do.
Sustaining attention. The person may not be able to concentrate on a task for very long. They may be easily distracted. The complexity of the task and the person's fatigue level can affect how long they can focus on a given task. Internal stimuli, for example, thoughts about lunchtime, or external stimuli, example, outside construction noise, may interfere.
Shifting attention. The person may be able to concentrate on one task but can't switch from one activity to another. They may get stuck on a task and may not be able to stop doing it.
Divided attention. Some people have difficulty coping with multiple tasks. For example, a student may not be able to listen to a teacher and take notes. Or the person may not be able to concentrate on cooking dinner while the radio is on. Problems with attention tend to get worse when the person is tired, stressed, or worried. Working in a place with as few distractions as possible can help.
Strategies to help with attention. Reduce distractions, such as noise, other people. Short, simple directions. Encourage the person to stay with the activity for longer periods. Change activities when necessary. When distracted, interrupt and bring back to task. Give reminders and routines.
Memory is easily affected by brain injury because there are several structures within the brain that are involved in memory, and injury to any of these parts can impair memory performance. As remembering involves the stages of taking in information, storing it adequately, and retrieving it when needed, injury to those parts of the brain responsible for these stages can lead to poor memory.
Short-term memory loss is the most common and troublesome type of memory problem. Examples of this are forgetting what has just been said, having difficulty in learning a new skill, repeating the same question over and over, forgetting people's names, getting details mixed up, forgetting a change in routine, and forgetting where things have been placed.
Short-term memory is the reason most people can understand sentences, both written and spoken. Recall small sequences of numbers, like telephone numbers. Remember what's on their grocery list. Essentially, short-term memory allows you to learn new things and interact with the world. This can explain why behavior changes after TBI are quite common.
One of the simplest ways to help people with memory problems is to adapt their environment. Some ideas for doing so, which are keeping a notepad by the phone for phone calls and messages, putting essential information on a whiteboard, corkboard where it's clearly visible, especially emergency numbers, deciding on a special place to keep important objects like keys, wallets or glasses and always return to same place, keeping a purse, pocket-sized agenda, calendar, labeling cupboards and doors, labeling perishable food with the date it was opened, getting medication in blister packs or sorting them in pill cases for AM, PM. Medications to track which day you have taken. List routines into smaller, more manageable steps to follow.
Brain injuries can affect a person's ability to communicate. Communication is not just speaking. It is also communicating through gestures, body language and written language. Language problems following a brain injury vary and may include dysarthria. Speech is slow, slurred or difficult to understand because the areas of the brain that control speech muscles are damaged. Apraxia. The person has difficulty saying words correctly. Aphasia. Some people with aphasia have problems with expressive language, what is said. Others have problems with receptive language, what is understood. Often a person may have more problems with reading and writing than with speaking and understanding.
Difficulty understanding and expressing information due to an ABI may present in some of the following ways. Difficulty thinking of the right word. Trouble starting or following conversations or understanding what others say. Rambling or getting off topic easily. Difficulty with more complex language skills, such as expressing thoughts in an organized manner. Trouble communicating thoughts and feelings using facial expressions, tone of voice and body language, nonverbal communication. Having problems reading others' emotions and not responding appropriately to another person's feelings or to the social situation. Misunderstanding jokes or sarcasm.
Technology and tools for augmentative and alternative communication have been known to be very helpful in improving communication for the individual. There are high-tech and low-tech possibilities. Numerous programs exist for PCs, tablets, and smartphones that can produce sentences, convert text to speech, and do other functions. The rehabilitation team's speech-language pathologists and occupational therapists will be able to help the individual gauge what kind of communication needs they have, and what will work best for them both based on needs and finances. Examples of tools, aids for memory and communication. Smartphone. Diaries, agendas, date books, notebooks, lists, alarm clocks, watches, calendars, wall charts, tape recorders, pill reminder boxes, sticky notes, photo albums with labels, cameras.
Executive dysfunction can cause problems with aspects of day-to-day functioning, such as starting or finishing tasks, planning ahead, making decisions, thinking through problems and forming solutions, using alternative solutions if needed, behaving appropriately and controlling emotions such as anger, interacting with others. As these effects are not visible, it is sometimes difficult for others to recognize or understand them. This can be upsetting, frustrating, or embarrassing for some brain injury survivors. On the other hand, some brain injury survivors themselves may be unaware of their executive dysfunction. Returning to work or education may be particularly difficult for survivors with executive dysfunction, as we rely on many of our executive function skills for working and studying, such as multitasking, organization, and motivation. Struggling to prioritize, make decisions and complete tasks can also cause challenges.
Difficulties with processing information. Information may be difficult for brain injury survivors to focus on or process, which may cause them to take longer to answer questions or react to the environment. This can be particularly challenging if there are distractions such as lots of noise, bright lights, or crowds, for example in a supermarket. Difficulties with making decisions. Being able to make decisions may be more difficult for a brain injury survivor. This may relate to simple decisions such as what to wear or have for dinner, or more complex matters such as decisions relating to finances. It may be difficult for the survivor to consider different options and possible outcomes, or to identify risks associated with decisions. Difficulties with making decisions can make some brain injury survivors quite vulnerable. There may be legal issues to consider if the person lacks capacity to make decisions in their own best interests.
Many physical effects of a brain injury can impact a person's activities of daily living. ADLs. These effects include ataxia, jerkiness, and coordination problems, balance problems, chronic, consistent pain, fatigue, difficulties with sleeping, and insomnia, headaches, swallowing issues, impaired motor control and motor planning, paralysis or weakness, perception and receiving sensory information, for example, phantom pain, sensory problems such as sensations on the skin, touch, and vision.
Pain. Pain is a complex issue for people with brain injury, as not only is there bodily pain, but the way you perceive pain may have changed as well. Pain can also make symptoms of brain injury worse, especially if it impedes the person's ability to perform rehabilitation exercises. Balance. Balance requires functional muscle strength, vision, vestibular function, inner ear, sensation in the skin, muscles, tendons, and joints. It also requires cognitive function and movement planning. When you are keeping your balance, your brain is continually processing inputs and information from multiple senses and body parts. The brain then sends directions out to the body's motor and sensory system, muscles in the arms, legs, core, and eyes, to keep you centered. Ataxia. Ataxia describes poor muscle control that causes clumsy movements. It can affect walking and balance, hand coordination, speech and swallowing, and eye movements. Ataxia usually results from damage to the part of the brain called the cerebellum or its connections.
Fatigue. Fatigue is the feeling of being extremely tired or having no energy or motivation. While everyone feels fatigue after periods of extended physical or mental labor, it is extremely common in people with a brain injury. There are three main types of fatigue. Physical. You don't have energy to complete tasks. Psychological. You struggle to get or stay motivated. Mental. You aren't able to concentrate or complete tasks. Bladder and bowel control. Following a brain injury, the person may not be able to control their bladder or bowel. The bladder or bowel may be overactive or underactive, or the person might not feel the urge to go to the bathroom, or know how to respond if they do. Swallowing issues. A person may not be able to chew or swallow regular food or drink liquids after a brain injury. Sometimes they will require a change in diet, for example pureed food or thickened fluids.
Headaches. Headaches are one of the most common challenges after a concussion. They can also be present after a brain injury. They can be debilitating, frustrating, and be a long-term effect. Headaches can be triggered by a variety of causes. Damage to your brain or nerves. Stress, dehydration, medication, pain due to neck or muscle, fatigue, lack of sleep, overstimulation.
Sensory impairment. A person's ability to hear, see, smell, touch or taste may be affected by a brain injury. Someone may experience oversensitivity to touch, inability to feel pain, touch, hot or cold, loss of vision, double vision or blurry vision, visual neglect, seem unable to see things on one side of their body or room. Changes in sense of smell or taste, ringing in ears, oversensitivity to noise, seizures. Seizures can occur after brain injury. They can cause a part of the body or the whole body to shake, or they can cause the person to appear to black out, be non-responsive for a few seconds. Seizures can occur soon after the injury or not until months or years later. Muscle weakness, paralysis. Often weakness or paralysis affects one side of the body more than the other. Activities of daily living such as washing and dressing may be difficult or even impossible for the survivor to do independently without assistance or aids.
Behavioral, emotional. Changes in emotion and behavior are common after an ABI and can be both a consequence of the areas of the brain that have been damaged. The process of dealing with having an ABI and the impact on your life and those around you. Common emotional reactions to an ABI include mood swings, depression, anxiety and fear, anger, frustration. Common behavior changes include indifference or lack of motivation, increased irritability, aggressive behavior, verbal and/or physical, socially inappropriate behavior, difficulties relating to others, personality changes. Changes in sexual functioning after an ABI are also common. Sexual functioning involves physical, emotional, social factors, all of which can be affected by an acquired brain injury.
Aggression, anger. After a brain injury, a person may display uncharacteristic aggressive behavior. This usually happens when the injured person is not yet aware of their situation, the injury and the consequences, and surroundings, where they are, what day or month it is. Aggression can show itself in a variety of ways, including damaging or destroying objects, excessive swearing, threatening to harm others, inability to self-monitor, verbal or physical attacks. Anger or an increase in irritability can be triggered by too much stimulation, example, light, noise and movement, confusion, frustration, fatigue, misunderstanding another person's intentions.
Anxiety. Anxiety stems from feelings of worry and fear. After a brain injury, people commonly worry about recovery being too slow, getting back to school or work, not having enough money, and relationship difficulties. Anxiety may lead to unhelpful behaviors, such as avoiding places or situations, rechecking things excessively, and asking the same questions over and over. Anxiety can be brought on by overwhelming situations or emotions, a person's thought process, or by upcoming events, appointments. Depression. In most cases, the individual's abilities and sense of self changes after a brain injury. Adjusting to a new self and situation is difficult and can result in elevated stress and feelings of sadness, anger, loneliness, and depression. Depression can also be caused by injury to the area of the brain that controls emotion, sexually inappropriate behavior. An uncommon behavioral effect of brain injury can be sexually inappropriate behavior. This includes making inappropriate comments about themselves or someone else, inappropriate actions, such as touching, and exhibitionism, which is the act of displaying genitals in public places or to people without their consent. This behavior can also include masturbation at inappropriate times or in inappropriate places. Self-image loss. Brain injuries not only change a person's abilities, they affect identity, e.g., who am I now, and self-image because of the physical, cognitive, emotional, and mental impacts. Someone with a brain injury may only focus on their limitations and fail to see their positive qualities. The emotions related to these changes can lead to behaviors such as withdrawal, avoidance or choosing not to take actions, and a lack of motivation to do anything, including work on rehabilitation and recovery.
Social dysfunction. Socializing after a brain injury can be difficult due to several factors, including how the person with a brain injury behaves. It's common for people living with acquired brain injury to have trouble keeping up in group conversations, lack awareness regarding how others feel emotionally, make inappropriate comments, misinterpret social cues such as facial expressions, mistake sarcasm for literal statements, show aggression and frustration. Trouble socializing can lead to social isolation, anxiety, and depression.
A brain injury is life-altering, and it is normal for both you and your friends, family to experience grief surrounding the changes in your abilities and your identity. Not everyone will experience all the common stages of grief, and they may not experience them in order. Denial. People in denial may engage in risky behaviors as a way to prove that nothing has changed. This is particularly common if decision-making has been impacted by the brain injury. Anger. They might direct the frustration they are feeling towards their family or their care team. Sometimes they are not able to control their outbursts of emotion. Bargaining, also called making a deal, and it's something people experiencing grief will do often. They may try to bargain with the deity of their religious belief, with doctors, or with others. They may also start making wistful statements that suggest they could have gone back and changed the outcome. Depression. They may feel overwhelmed, emotional, lost, and alone. But it's important to work to move beyond this stage by talking with friends, family, and mental health professionals. Acceptance. The person has come to terms with their new situation. It doesn't mean those negative feelings and thoughts are gone or that the person is happy. When they reach the acceptance stage, they will be doing their best to focus on moving forward, taking ownership of their recovery, and finding the good in each day.
Returning to normal life after an ABI. Make a plan. Plan ahead for your release as soon as you can. Talk openly about your needs, wants, and capabilities with family members and caregivers. Write everything down. Make sure to have a plan written down that includes any follow-up appointments, medication and prescriptions, special equipment that might be needed, specific care instructions, therapies that may be required post-discharge, things to avoid during recovery, rehabilitation, local agencies, BIA NBA, March of Dimes, CAMH. Emergency phone numbers. Changes that should be identified and discussed. Bathing and hygiene. Emotional and mental health care. Ongoing rehabilitation appointments. Other forms of personal care, e.g., cooking and cleaning. Physical care. Medications.
Rehabilitation. Rehab can take many forms depending on your needs. It might include physical, occupational, and speech therapy, as well as psychiatric care and social support. All these are designed to help you recover from the effects of your injury as much as possible. Rehab may help improve your ability to function at home and in your community. Help treat the mental and physical problems caused by TBI, provide social and emotional support. Help you adapt to changes as they occur during your recovery. Rehab can also help prevent complications, such as blood clots, pain, pressure ulcers, also called bed sores, breathing problems and pneumonia, muscle weakness and muscle spasm, bowel and bladder problems, reproductive and sexual function problems.
Substance use after an ABI. About 20% of people who survive a traumatic brain injury will develop a new problem with substance use. Brain injuries that have an impact on emotional regulation or risk-taking may increase the risk of substance use disorders. In general, research suggests that it is best to avoid using alcohol or other substances after brain injury to allow your brain to heal and avoid more serious problems. Understanding how drugs affect recovery after brain injury can help you to make a better decision. There are several effects that substance use can have on someone after their brain injury, including impulsivity or poor judgment, increased risk of seizures, increased risk of another brain injury, slowing down or limiting recovery, problems with balance and walking, problems with concentrating and memory, feeling increased effects from alcohol and drugs, increased feelings of depression, negative interactions with prescribed medications.
Research shows that over 235,000 people experience homelessness across Canada each year. In reality, this number is much higher because many people stay with friends or family or don't go to shelters, and approximately 50% of people experiencing homelessness have a brain injury. The relationship between brain injury and homelessness may be bidirectional. Acquired brain injury can lead to homelessness, and homelessness may increase the risk of acquiring a brain injury. Having worked in the shelters myself, I can identify that being homeless creates a huge risk for brain injury.
Intimate partner violence, IPV, statistics. TBI is common amongst survivors of intimate partner violence, IPV. 35 to 80% of women affected by IPV experience symptoms of a traumatic brain injury. Up to 92% of IPV incidents involve hits to the head and face, and strangulation. It is reported that up to 75% of women do not seek medical care for a suspected brain injury. Survivors and care providers can also mistake brain injury symptoms for the emotional distress brought about by the abuse itself. Strangulation is one of the most dangerous forms of IPV, increasing the risk of death in following assaults. Strangulation can also cause a brain injury, due to the brain being deprived of oxygen. Some victims can die weeks after being strangled because of the underlying brain damage, even if there is no visible injury. Aboriginal women are 3.5 times more likely to experience violence than other Canadian women.
A few more statistics. A Canadian study found adults with concussion committed suicide at 3 times the population norm. 50% of patients experience personality change, irritability, anxiety, and depression after concussion. These neuropsychiatric symptoms are not unique, but part of the natural course following concussion. In a national population health study of neurological disorders, illness and injury, the highest prevalence of self-reported diagnosed mood disorders was seen in those with a traumatic brain injury, 38.3%, or brain tumor, 35.5%.
Know your local agencies that can help. In Northern Ontario, Brain Injury Association of North Bay and Area, 705-492-0886. Contact at beyondba.ca. March of Dimes Canada, North Bay, 705-498-6296. Toll free, 1-866-594-8333. CMHA North Bay and District, 705-476-4088. Toll free, 1-888-476-4088. Contact us at nbd.cmha.ca. Ontario Health at Home, 301-2222. Toll free, 1-800-461-2919. District of Nipissing Social Services Administration Board, 705-474-3540. Toll free, 1-800-461-6977. Service Ontario, 705-474-2151. Toll free, 877-829-5121. North Bay, ACSD, Office, 705-493-0872.